Hello guys, today we will discuss about the important topic. This is anaphylaxis, which is very important at any site when you are treating a patient. So guys, this objective of today's topics are hypersensitivity reactions, define the anaphylaxis, etiology causes, pathophysiological mechanism, sign and symptoms, diagnostic investigations and treatment and first aid for the anaphylaxis reaction. So guys, started with the hypersensitivity reaction where it is referred to as an overreaction of the immune system, and these reactions may be damaging, uncomfortable or occasionally fatal to the patient. And it may occur with the two situations when firstly if there is foreign antigen enter into the body and that may be uncontrolled, or in secondly where the immune response due to the self antigen or this is directed against the self antigen which is known as the autoimmunity. So guys, there are different kind of the hypersensitivity reactions are found, where the type 1 hypersensitivity reaction which is due to the allergy, immune or immediate reactions or anaphylaxis. These are IgE mediated reaction, and example for this is the classical allergic reactions. And type 2 hypersensitivity reactions are the cytotoxic reaction which are due to the antibody mediated reaction, and these are IgG or IgM mediated reaction. Classical example is the RBC analysis or hemolysis. And in type 3 reaction, which are the immune complex mediated or immune complex disease which are due to the IgG mediated reaction or immune complex diseases, which are example are serum sickness. And type 4 hypersensitivity reaction are the delayed type hypersensitivity or cell mediated reaction which are T cell mediated immunity, or these are delayed type reaction. Examples are tuberculosis, granuloma. And type 5 hypersensitivity are the autoimmune disorders which are IgM or IgG mediated or complement mediated reactions. Examples are Graves disease or myasthenia gravis. So guys, anaphylaxis is the terminology which is taken from the Latin term which is divided into the ana means without, or phylaxis is the protection. So without protection, if any reaction is seen, is known as anaphylaxis, which is the serious allergic reaction that is rapidly in onset, taken seconds or minute to the hour, and that may cause death. And these are IgE mediated type 1 hypersensitivity reaction which results in the release of potent chemical mediators which are mast cell or basophil, and these affect the multiple organ system as respiratory system, cardiovascular system, digestive system or dermatological system. So guys, etiologically most common causes of anaphylaxis is the idiopathic followed by the food allergens, and drugs having the second to the food allergens and exercise may also cause the anaphylaxis, and very few but may be caused due to the latex, hormones or insecticide as the 2% of the total anaphylaxis reaction. So guys, one by one if we discuss about the food allergen, are the peanut is the most common cause of food allergy, and others are shellfish, seafood and wheat allergy, and other are the cow milk allergy, soy allergy, egg allergy. In the pharmacological agent or drugs are antibiotics are the most common causes of the anaphylaxis reaction, which is the penicillin or another third generation cephalosporin or other drugs. And non-steroidal anti-inflammatory drugs as the aspirin may cause anaphylaxis, and intravenously if we are using the contrast agent may cause anaphylaxis. And stinging insects are the ants, bees, horns, bats, etc. And latex having very less common of the anaphylaxis reaction, but it may be common in the hospital setting due to the using of the latex gloves or other common particles which are using in the hospitals. And the pathogenesis of the anaphylaxis is very important when immunological substances as the food, insects, bites or medication or any other latex particle is using, or any immunological causes which causing the complement cascade activation or coagulation pathway activation, or if the agent causing the direct mast cell activation as exercise, any cold or medication as opioids or any other which causes mast cell or basophil activation. These may release the mediators which are histamines, tryptase, carboxypeptidase A, kinase, PAF, prostaglandins, leukotrienes or other mediators which cause reactions on the body systems, may cause on the skin, respiratory system, GI system, CVS system or CNS system, eyes, etc. So guys, there may be found some signs and symptoms and skin having the itching, flushing of face, hives or urticarial reaction or swelling. In eyes, you may find itching, tearing of the eyes, redness of the eyes, swelling around the eyes, and in nose and mouth, you may find the sneezing, running nose, nasal congestion may be there, swelling of the tongues or metallic taste of the tongue, and in lungs there may be difficulty in the breathing, coughing, chest tightness may be found, wheezing or other sounds may be found, increased mucus production or throat swelling or itching may be there, change in the voice as the hoarseness of the voice or sensation of the choking may found in the throat. So guys, in the heart or circulation or cardiovascular system, they may found some dizziness, weakness, fainting attacks or rapid or slow or irregular pulses or heart rate, or there may be arrhythmia or low blood pressure or hypotension. And in the digestive system, there may be nausea, vomiting, diarrhea or crampy abdominal pains may found. And in nervous system, there may be anxiety, confusion or sense of impending dooms. So guys, when you find these symptoms or any symptoms, you should diagnose as on the basis of anaphylaxis is based upon the symptoms that occur suddenly or rapidly after being exposed to the potential trigger. When a trigger come into contact with the body, or you may find these symptoms, you may able to diagnose the anaphylaxis, and we should differentiate with the acute severe attack of the asthma, heart attack, panic attack or any food poisoning. So guys, anaphylaxis can be diagnosed on the basis of these clinical criteria. There are 3 clinical criteria. Out of these 3 clinical criteria, if any one is present, may diagnose as anaphylaxis, as if there is involvement of the skin or mucosal membrane or mucosal tissue along with any one of the following having respiratory compromise or reduced blood pressure associated symptom of the end organ dysfunction. And second criteria having if there are any 2 or more of the following symptoms having the involvement of the skin or mucosal tissues, respiratory compromise, is there any reduced blood pressure or associated symptoms or persistent gastrointestinal symptoms. Or third criteria is if there is reduced blood pressure or hypotension following exposure to the known allergen found in on the basis of the age group in infant and children having low blood pressure according to the age or more than 30% drop in the systolic blood pressure, and in adults if the systolic blood pressure is less than 90 mm of Hg, or if there is dropping of the more than 30% of the baseline blood pressure. So guys, if you find any one of the criteria, the first aid management should be treated as in the emergency care. You may call for a help to the assistant, and if having epinephrine or adrenaline, inject immediately at the outer muscle of the thigh IM. And if the patient stop breathing, we can CPR at the side. So guys, in the first aid, these are very important. We should place the patient Trendelenburg position where the head is down and leg should be up, and establish the airway maintain with the position, and give the oxygen via the nasal cannula as needed, and place the tourniquet above the reaction sites. and epinephrine or adrenaline at the site of injection can be injected and start IV to raise the blood pressure or maintain the circulation. So guys, when these important steps are taken, we can use the drugs as adrenaline or epinephrine is very important, can be used at the rate of 0.01 milligram per kilogram, maximum up to 0.5 milligram IM injection at the lateral of the thigh. It acts by the adrenergic receptors to maintain the blood pressure and antagonize effects of the release mediator, and it may also stop the further release of the mediator. And another drugs are the antihistaminics or H1 antihistaminics are the diphenhydramine, hydroxygen or cetirizine. These primarily affect against the cutaneous effect of the anaphylaxis or dermatological effect of the anaphylaxis. And H2 receptor antagonist like the cimetidine, which block the effect of the release histamines, and this act by the treating the vasodilatory effects. And bronchodilatory effect by the albuterol, which stimulate the beta 2 adrenergic receptor causing bronchodilation. And volume expander can be used as the crystalloid or colloid, and corticosteroid, methylprednisolone, prednisolone, Dexona, etc. can be used as the anti-inflammatory agent. So guys, there are very important steps which is the prevention from the anaphylaxis reaction. These are, we should avoid the responsible allergen which are food, drug or latex which is known to the allergy for the individual, and the individual who having the known allergy should keep adrenaline kit as epipen and Benadryl on hand at all time. And those patients are known allergic, they should wear the medic alert bracelets, or venom immunotherapy is very highly effective in the protecting insect allergic individual. So guys, these are preventive measures which can prevent the anaphylaxis reaction. And if we are treating the patient or using penicillin like drugs, we should keep in our hand adrenaline injection pre-filled syringe. So guys, this is all about the anaphylaxis, and if you did not subscribe our channel yet, subscribe the channel and press the bell icons and share this video to all the medical students. Thank you very much.